Hi, I'm Meggan Eldredge, the Health Director for the town of Harwich. I'm here today to talk to you about COVID-19, and I hope to answer some of the questions the public may have. Coronaviruses are a large family of viruses, one being SARS, Severe Acute Respiratory Syndrome. You may remember that from years past. And now a new coronavirus, COVID-19. COVID-19 spreads in several ways. It is infectious person to person through respiratory droplets. These are droplets contained in a person's breath and dispelled through breathing, coughing, sneezing, or secretions. These droplets can enter another person's body directly by close contact with an infected person, as well as indirectly by touching a surface that has been contaminated by the virus, and then touching your own face, mouth, eyes, and nose. Also touching an infected surface with your hands and then eating without washing your hands will also transmit the virus. The best way to prevent illness is to avoid being exposed to the virus. Social distancing is a powerful tool used in public health to prevent the spread of respiratory illness. Other more restrictive tools, such as school closures, restaurant restrictions, and cancellations of events, are necessary now because the virus is no longer limited to people who have traveled to a country that is experiencing the outbreak of coronavirus. The virus is now spreading person to person within communities with no link to travel. Because some people will remain asymptomatic, meaning no fever, no cough, we are promoting social distancing by canceling events and gatherings of 25 people or more. This effort limits the possibility of spreading the illness to a large number of people at once. Having coronavirus within our community is inevitable. However, the goal of these public health measures is to reduce the number of people who will require medical intervention so we don't overwhelm our healthcare system. A surge in medical needs due to COVID-19 has the potential to limit the availability of our emergency services to treat all people who may need their help, having medical traumas, heart attacks, strokes, motor vehicle accidents, etc. COVID-19 has proven to be most dangerous to people over the age of 60, people with underlying health conditions such as diabetes, those who are immunocompromised, and pregnant women. We call this group of people the highly susceptible population. Limiting this population's exposure to the virus is done by limiting everyone's person-to-person contact. Because COVID-19 can spread while a person is asymptomatic, it's important to keep social distance and personal hygiene. Hand washing and avoiding touching your face are two ways to prevent infection. The town is promoting social distancing by closing municipal buildings to the public and canceling events that would put more than 25 people in one space. We will continue to conduct as much business as possible through phone, email, and regular mail. We are currently working on plans to accept documents and will distribute that information as soon as possible. Information regarding public meetings of regulatory boards, town meeting, those informations will be forthcoming from the interim town administrator. A few great resources for up-to-date information on coronavirus are two websites. One is mass.gov. They have a banner at the top that you can click on for up-to-date information on coronavirus cases within the county as well as the state. www.barnstablecountyhealth.org has CAPE-related information up to date. And lastly, the Massachusetts Department of Public Health has announced the availability of a 24-hour state-supported telephone hotline. By calling 211, you can be provided with a real-time COVID-19 information expert, providing resources and referrals in multiple languages. Our most frequently asked question has been about what to do if you are sick or a person you know is sick. If you develop symptoms of a fever and cough, stay home and don't panic. These symptoms are similar to many other illnesses, such as the common cold and seasonal flu. Contact your healthcare provider Do not go to the hospital or an urgent care center without calling them first. This will give them time to prepare for your arrival. Testing is available to people that have a doctor's order. If your doctor feels you are at risk for having COVID-19, they will give you instructions on how to get tested. We are not testing everyone at this time unless they fall into specific guidelines. These guidelines include healthcare workers, people who have traveled recently to a level 2 or 3 country, and people who have been in contact with a person who has tested positive. Others will be tested at the discretion of their doctor. The best thing to do right now is cooperate with the request to stay 6 feet away from others, not congregate in groups, stay home if you are sick, and wash your hands often. This effort will be best if we all do our part in slowing the spread and flattening the curve. Thank you for listening. Take care of yourselves and each other.